Is Pepto-Bismol safe for children and pregnant women? If you've ever had an upset stomach or nausea, you might have wondered if Pepto-Bismol is safe to use, especially if you're pregnant or caring for a child. Let's explore the facts based on trusted medical sources. Pepto-Bismol contains an active ingredient called bismuth subsalicylate. This compound is related to aspirin, which is a type of salicylate. Because of this, safety concerns arise for certain groups. For children under 16 years old, Pepto-Bismol is generally not recommended. The reason is that salicylates have been linked to Reye syndrome, a rare but serious condition that can cause swelling in the liver and brain. Reye syndrome most often occurs in children recovering from viral infections like the flu or chickenpox. Because of this risk, health authorities advise against giving Pepto-Bismol to children and teenagers. For pregnant women, the situation is similar. Pepto-Bismol is usually not recommended during pregnancy, especially after the 30th week. The salicylate component can increase the chance of bleeding during delivery. It has also been associated with birth defects affecting the baby's heart when used in high doses or over long periods. While direct evidence of harm from Pepto-Bismol is limited, the known risks linked to salicylates like aspirin lead most medical guidelines to recommend avoiding it during pregnancy. Instead, pregnant women can consider safer options such as specific antacids or acid reducers, but these should always be used under the guidance of a healthcare provider. Breastfeeding women should also avoid Pepto-Bismol because salicylates can pass into breast milk and potentially affect the nursing infant. The safest approach is to consult a healthcare professional before taking any medication while breastfeeding. In the context of ulcers and peptic ulcer disease, Pepto-Bismol may help soothe symptoms like nausea or diarrhea. However, because of its salicylate content, it is not suitable for children or pregnant women. Salicylates can irritate the stomach lining and may worsen ulcer symptoms. For managing ulcers, doctors usually recommend other treatments such as proton pump inhibitors or specific medications that do not contain salicylates. To sum up, Pepto-Bismol is not safe for children under 16 due to the risk of Reye syndrome. Pregnant women, especially after the 30th week, should avoid it because of bleeding risks and potential birth defects. Breastfeeding women should also steer clear because salicylates can pass into breast milk. Always talk to a healthcare provider before using any medication during pregnancy, in children, or while breastfeeding to ensure safety. Remember, there are safer options available, and medical advice is key to managing digestive issues safely.